Hey, Dr. John Swetech here from Swetech Medical Center. Let's talk about asthma today. What is asthma? A lot of people don't even know. Your lungs, you have your trachea, that's your air pipe down to your lungs, and then it switches into two pipes called the bronchi, and then you have bronchioles. So, asthma is a condition of hyperresponsive airways. Basically, something that irritates your airway causes them to what we call bronchospasm. Basically, when throughout your day your airways are supposed to open and close to adapt to what's going on. Bronchospasm, basically they constrict and they get stuck, and a lot of times you get wheezing, but that's not always the case. A lot of people have coughing, some people have chest pain. I'm making this video right now because we do have a decent amount of people coming in with some asthma flares. Anytime there's a season change, people are exposed to new conditions, different pollens, different things in the air, and it can set things off. Number one, if you have asthma, you should figure out what is causing your symptoms and try to avoid it as much as possible. A lot of people are also aggravated by smoke fumes. If it is that, you probably need to stay away from smokers, and some of my asthmatics are smokers and they need to stop, more or less. So number one, stay away from triggers. Number two, we absolutely need to get it under control so that everyone seems to agree if you're only needing a rescue inhaler maybe once or twice a week, that's considered controlled. But we need to make sure you have a effective maintenance regimen so that you can use your emergency inhaler less than maybe 2 times a week. If you're using an albuterol, that's a short-acting beta-agonist inhaler, more than this time, you most likely would benefit from adding some other inhalers or medications on. I have a chart, and it's all in my head, but they have all these inhalers. There's about 20 or 30 of them, and all the companies are always making new ones and combining things. But usually you start with the emergency inhaler, and if you can get it under control with that, you're good. But if you need more, they have ones that kind of give a long-acting albuterol sort of signal. We have some inhaled corticosteroids, and there's also some that manage the cholinergic pathway. A lot of people with asthma can get predisposed to different viral and bacterial infections. So if you have asthma at first sign of trouble, you probably should get into a doctor or something like that, get it checked out. My secret weapon in the battle against asthma, there is a medication called Singulair or Montelukast. It's one of the few allergy medications that's prescription only still. It also is approved for asthma. What it does is kind of cuts down on inflammation in the airway. We find that if you take this at bedtime, it's not really sedating, but it blocks these leukotriene chemicals that kind of peak between 2 and 4 a.m. If you block that, you usually wake up feeling a little bit more fresh, and you tend to need less of your emergency inhaler. So the bottom line is there's a lot of options. If you can get your use down a couple times a week or less, you can stay out of the urgent cares and emergency room, and that's really what's ideal. People with asthma should probably get a pulmonary function test or spirometry every year or so. What does that do? That kind of makes sure that so asthma is a reversible defect. Basically, when you get your flare, things kind of constrict, but when you use medication, it should go back to normal. We want to make sure that it's staying that way and not getting worse over time. If that is the case, you might have something else going on. So one other thing I did want to talk about, exercise-induced asthma. There are a lot of people, and it's quite common actually. A lot of people, when they exercise, they get wheezing or shortness of breath. This could be a number of things, but a lot of times it's exercise-induced asthma. If you have this, there's no reason to struggle with it. Sometimes a few puffs of albuterol before you work out can help prevent the problems from even happening. So just giving some information out there. Obviously, there's specialists that deal with asthma. That's their whole career, so it is a lot more complicated. I try to give you the 10,000-foot view. If you have problems with asthma, get in, we'll talk about it. Obviously, like I said, some people get chest pain and cough and whatnot. So it's not always wheezing and shortness of breath. And that's pretty much it for the overhead view. Yeah, so watch those triggers and let's keep everyone out of the hospital. Thank you. Have a good one.